In today's video, we're going to be talking about strangles and what we need to do to try and prevent it. My name is Brandi. Welcome to my channel. If this is your first time here and you want to learn more about horses and follow my horsemanship journey, start by subscribing and dinging that bell so you don't miss out. I'm here today with Dr. Reid from the Animal Medical Center, and today we're going to be talking about strangles. Can you tell me what strangles is?
Yes, I absolutely can. I will start by saying that strangles is a giant pain in the rear for any horse owner. I do not wish it upon my worst enemy. So strangles is a bacterial infection of the upper respiratory tract. Typically causes signs of fever. We typically think about swollen lymph nodes. Any lymph node in the body can be affected.
Okay.
There's a whole bunch of lymph nodes in the neck and throat latch area, so any of those lymph nodes can be affected. What'll happen is they'll get really big, hot, painful, and they'll burst out with abscesses.
Okay.
That's the typical presentation of a strangles horse.
Okay.
That's how it got its name, because the lymph nodes can get so big that they can actually strangulate the horse.
Okay. I have a horse that will occasionally get swollen lymph nodes, and it's almost like there's like a hot dog underneath her skin there.
Yeah.
So
yeah, absolutely. Because those lymph nodes can get really big, painful, swollen, they can sometimes have a hard time breathing, swallowing. They can stand with their neck extended. Any combination of any of those signs.
Okay.
That's the outwardly presenting horse with strangles. The tricky thing with strangles is that some horses are carriers, that they can have the bacteria, they can be harboring the bacteria but not be symptomatic, that they cannot show a fever, they cannot show swollen abscesses or pussy noses or anything like that. They can be totally fine walking around, life is good.
Okay.
Those are the tricky cases.
So for me, for instance, I have boarders and I take on training horses and have a lesson program and we haul to shows. Well, with horses coming into my property, how can I protect my horses from getting that as far as like quarantine? So I can quarantine the other horse. How long should I quarantine them?
Okay, so I'll back up and I'll say that the bacteria, it's called Streptococcus equi, subspecies equi, it's a bacteria. It's shed in the nasal secretions or through draining abscesses. So think about your kids going to school and picking up a cold, right? One kid sneezes on another, there you go. One kid sneezes on the box of crayons, then your kid picks up the box of crayons. That is how strangles is passed. So either through direct contact, horse nose to nose, through their normal social behavior, or an infected horse drinks out of the water bucket, and then another horse follows into that bucket, sharing bits, sharing halters that have snot boogers and abscess gunk on it. That is another good way to infect horses.
Okay.
So when we're dealing with horses that are not symptomatic, that don't have fevers, that don't have swollen abscesses, that don't have draining noses or anything like that, then quarantine is our best option. That is how we can protect the other horses on the farm. The question of how long is kind of a non-answer, because when we quarantine, when we bring a new horse in, we're not just quarantining for strangles, we're quarantining for a whole bunch of other diseases.
Yes.
So we kind of hedge our bets on how long do we do it. The typical disease process in strangles is anywhere from 2 to 14 days.
Okay.
So if we arbitrarily pick 3 weeks or 4 weeks, then we should be okay.
Okay.
That's also going to cover us for any other possible diseases that horse could be bringing in. So 3 to 4 weeks, it's a long time.
Yes. Yes. Especially if you've got like horses that you're training and need, limited space and need to move them and that sort of thing. But if you're protecting your herd, it's the most logical thing to do. So now with that being said, okay, so vaccinating against strangles. Can we vaccinate against strangles?
Yes, we can absolutely vaccinate against strangles. Only horses that are well and healthy enough to receive the vaccine should get the vaccine. Period, plain and simple, the end. So there's a couple of different vaccine types out there. There's a injectable one where it goes into the neck, just like all the other vaccines do. Then there's one that gets squirted up the nose.
Okay.
There are two different types of vaccine. They work differently to provide immunity. It is not recommended that horses that are symptomatic or in the face of an outbreak receive the vaccine.
Okay.
We're more likely to cause really bad side effects
Okay.
if horses are sick
Okay.
or they are on a farm that is actively fighting a strangles infection.
Okay.
They're more likely to get really bad side effects,
Okay.
which I'm sure we'll get to in just a minute.
Yeah.
So-
How effective is the vaccine?
The vaccine is very effective.
Oh, okay.
Yep, it is very
That's good to
effective. It is just like any other vaccines. It gives us the best chance to protect our horse, to protect our farm, while we can go out and still enjoy our horse by going to shows and trail rides and things like that.
And either one, the IM one or the nasal one, either one is
Yeah,
as effective?
Yep, I personally like the intranasal vaccine
Okay.
better because it gets to the area where that bacteria is going to first be introduced into the body, and it's giving us that local immunity right there in that nasal passage, in the tonsils, giving us that best chance of immunity at that site.
Okay.
The injectable vaccine does provide really good immunity. Like I said, it just works a little differently to provide immunity.
Okay. Well, the intranasal one, I can say from experience of witnessing it that when you do the intranasal vaccine, you also vaccinate your vet against it because they get it sneezed all over them
Yeah, true
almost
story. True story.
seconds later.
Yeah. For those of you who don't know, the intranasal vaccine is administered with a really long straw. It's about a 6 to 8 inch really long straw that gets placed up your horse's nose, and then the vaccine is squirted in there. And the idea is that it's getting way back in the back of the throat to that area where the horse is going to be in contact with the bacteria first.
Something to keep in mind if you're going to do the intranasal vaccine for strangles, make sure to play with your horse's muzzle. Make sure to handle it often and maybe put your thumb up inside and just rub them, make sure to give the release when they're quiet about it. Your vet will appreciate that very much and will save a tremendous amount of time when the time comes to do it. So now, horses can be lifelong carriers of strangles. So with that being said, what happens to that horse if they're a carrier? Like, can they go anywhere? Can they do anything? What does that horse's life end up to be like?
Yeah. So it's not necessarily lifelong. It's that horse is a silent carrier. So it doesn't have outward signs.
Is it kind of like a cold sore?
Kind of like how people get herpes virus and they get the cold sores and it kind of goes away and we don't really see the cold sore. Yeah. So horses have in their head, in the kind of the back of their throat, what's called the guttural pouches. And the guttural pouches are these big sacs that we don't really know why horses have them, but they have them.
Okay.
They have them.
Okay.
And when a horse is a carrier, they typically have the lymph nodes that are just inside, right close to the guttural pouches, abscess into the guttural pouch, and then they have this nice little pus pocket in the back of their throats that will drain into the nasal cavity so they can sneeze and infect others. Nice. That's how it's
Yummy.
It's pretty awesome. It's pretty awesome. So those are the horses that I think about are as carriers.
Okay.
That again,
carriers.
they're not outwardly having abscesses blowing
Right.
or snotty noses, but they are carrying, they are harboring the bacteria and they are infecting others.
Okay.
Those horses can be difficult to find, to treat, and to get them clear. It takes a little bit of work and it takes a little bit of patience.
Okay.
Typically we find those horses when there's a new horse introduced to a farm, and surprise, we have a whole bunch of horses break with abscesses, and we have a whole bunch of horses break with fevers, and we don't know until that horse has already infected other horses. That horse that is a carrier, we really need that horse to go for referral and get the guttural pouches scoped and flushed, because that is the only way that we can get all of that nasty crap out of there.
Oh, okay.
We can also treat the guttural pouches once we're in there with the scope. Treat with either an infused product, or sometimes we just tackle it with IV or IM antibiotics to get that horse clear.
Okay.
The way that we know that horse is clear is by doing either repeat scopes and taking swabs of the guttural pouches for culture.
Okay.
And we need to have 3 negative cultures before we can say that horse is no longer infected and no longer carrying.
So without having those 3, a horse should not travel anywhere, or other horses shouldn't be brought in unless you know for sure that horse is free and clear. Yes. Otherwise, the risk of spreading it further.
Yep.
Okay.
Yep. On another note, this is why I also say that Strangles is a giant pain in the butt, is because horses that have been previously vaccinated can also get the disease.
Okay.
So the vaccine is as good as we can make it, but every individual's immune system is different. And that's where I like to use the human flu vaccine as an example.
Yes.
You and I can both get the flu vaccine, but I can still get sick and land myself in the hospital, and you can be totally fine.
Right.
So every individual's immune system is different.
Okay.
It's impossible to predict which horse that has been vaccinated is going to get sick and which one isn't.
Okay.
But it's something that the vaccine is the best that we have, but it's not 100%.
Okay. Okay. What kind of side effects are there from having strangles? Like, can it be fatal?
In the rare case, it can be. That, I think, is the exception, not the rule. Some of the side effects of strangles are, one, it's termed bastard strangles. What it is the lymph nodes that are commonly infected, right up here in the throat latch that will strangulate horses. Other lymph nodes in the body can be infected as well, and that's the metastatic, or throughout the rest of the body, those lymph nodes can be infected. That's what's called bastard strangles.
Okay.
So that's a complicating thing of strangles. A condition called purpura hemorrhagica is also a complicating thing with strangles, and that is an immune response that the body basically attacks its own vessels, and you get a really bad case of vasculitis. So all the vessels in the legs, they get kind of leaky and they get swollen and edematous. That can be pretty serious. Okay. That can happen as a result of an infection. That can also happen as a result of vaccinating a horse that shouldn't be vaccinated. So this is where, before that vaccine is administered, a veterinarian has to determine, is that horse well and healthy enough to receive that vaccine.
Okay. Well, kind of like with a flu shot. You can't get a flu shot if you're sick.
Yep. Absolutely. Absolutely.
Are young horses or older horses, kind of like with the flu, it can really affect young people and elderly people more? Is it the same thing with strangles, or is it like pretty common, or pretty much across the board with everybody? Like, is an older horse at more of a risk of having more complications, do you think?
So younger horses, yes, absolutely. This is younger horses, ones that are under 5 years old. These are the horses that I think of as you're going to get strangles. Like, these are the ones. Just
like preschool.
Kind of like preschool. You send a kid and it's like a giant cesspool.
Stop licking things.
Yeah, exactly. Same thing with young horses.
Okay.
So young horses, yes, absolutely. They're the ones that are going to be at highest risk because they don't have the best protective immunity against that. Okay. Yes, absolutely. Older horses, I do kind of place them in a higher risk. Okay. Because we know with age, we don't have the greatest immune system sometimes, and we often have concurrent disease process, like arthritis or sometimes metabolic disease or some other things that can also lower the immune system. So I do place them in a category of, let's not put the seniors by the young ones. Yeah, that makes sense. Let's not send grandma to preschool. Let's not do that. Yeah.
Okay. So let's talk about some of the things that we should do as horse owners to try to prevent this. So a lot of times when I go to an event, I see community buckets. So a water bucket that's shared between a lot of different horses, somebody just kind of going down the line and offering drinks. I see that often. So avoid that.
I would.
For sure.
I love those people because those people have saved my butt at horse shows more times than not, and I do thank them. But when we talk about disease transmission, that is the thing that is going to put your horse at the highest risk.
Yeah.
Is sharing a bucket, either a water bucket or a feed bucket or a hay net or anything like that with horses that they don't know.
Okay.
Horses that you don't know that maybe aren't vaccinated or aren't vaccinated properly, or they're, those horses are young and you maybe have an older horse.
Okay.
So we have to really be careful. Sharing bits is in that same category. When it comes to sharing tack, what I think about there is that the bacteria doesn't live long outside of the body. So if a horse sneezes in the water bucket and then another horse drinks it, that second horse is going to get infected. But if that one horse sneezes into the bucket, and say it's a grain bucket, sneezes in that grain bucket, and that grain bucket is sitting in the sunshine. 2 days later, you feed your horse out of that grain bucket. Chances are your horse is going to be fine because the sunlight is going to kill the bacteria. The bacteria doesn't live long outside of the body.
Okay. That's good to know.
So this comes into the topic of tack and bits and bridles and halters and blankets and all of the things that get passed around at shows and on trail rides because your bridle breaks and you got to switch and all of those things. Cleaning it, cleaning anything that can be cleaned, washing bits down with hot soapy water before you put it in your horse's mouth. Anything that can't be washed, like you can't put your saddle in the dishwasher.
Right.
It's not a thing. Putting it in the, cleaning it the best you can. If there's any dirt, debris, obvious boogers on it, clean the boogers off. Set the saddle in the sunlight.
Yes.
Get good sunlight for a day or so. Same thing with blankets that can't be washed. Get good all sides. Flip the saddle upside down. All of that contact, and that's one of the best things that we can do to prevent horse-to-horse transmission, especially when you're bringing new tack and new equipment into your facility.
Okay. Something I've always thought of is like when a vet or farrier comes to my barn, or equine massage therapist, anything like that, they're going from one barn to the next. And I used to go to a lot of different barns to give lessons and train horses. And I always thought about that, how easy it might be to transmit things from one barn to the next, just from our clothing, our boots, our equipment, stuff like that. So what do you recommend as far as like for instance, if you were to be around horses that had strangles, what precautions would you take to make sure that you don't bring it to the next place?
Yep. So I, as a veterinarian, can absolutely be what we call a fomite, or an object that transfers disease from animal to animal. I can absolutely do that. My stethoscope is a lovely example of that. The stethoscope touches a lot of animals, and it can transfer a lot of disease if I don't clean it properly. So if I have to go to a farm where I'm suspecting either strangles or other respiratory disease, I'm going to schedule that at the very end of my day, preferably at the end of my day, at the end of my week. So I have the opportunity to wash all of my clothes, anything that has touched a horse.
You clearly haven't touched a horse today.
Clearly not. Anything that's touched a horse is going to get washed, in hot soapy water. Anything that can't be washed in hot soapy water is going to get wiped down with a disinfectant that is appropriate for that surface. So I can't bleach my stethoscope, but I have these lovely wipes that get viruses and bacteria and things like that. Boots, manure, anything that is in contact with the horse should be cleared, should be cleaned. So the same thing with farriers, that if you have an upper respiratory disease, strangles, if you were even thinking that is happening, then being open about it. Hey, you're coming on Friday, gonna be like, the horses have got to have their feet trimmed. Let's schedule it at the end of your week. So then I want you as a farrier to only bring the minimum what you need. Only bring what you need. Don't bring all of your equipment.
Right.
Because you're going to have to clean it all.
Absolutely.
Cleaning anything that can be cleaned. disinfecting it the best that you can. If not, sunlight's your best friend. And doing the best that you can, but being open and honest about what's happening is going to
Absolutely.
protect the horses in your surrounding community.
Okay. Well, a friend of mine, she had a large outbreak of strangles at their barn, or I should say it was a large barn that had an outbreak, and they were unsure of how many horses were infected. And basically, she put out a mass post on Facebook to everybody just saying, hey, our barn had this happen and we're taking care of it, but we want to notify everybody just to let you know so you don't come into our barn or leave our barn and accidentally spread it around to more places. And then once their barn was cleared, then they're good to go. So, and I really have a lot of respect for that, because as a horse owner, I would hate to go into their barn and then accidentally carry that stuff home to my barn. So I think I think that being open about it is a really good way of going about it and keeping others safe.
I agree wholeheartedly. I think the other thing that I'm going to piggyback on with that is having an open, honest conversation with your veterinarian as soon as possible.
Absolutely.
If you even think that this is happening, then get your veterinarian to that farm to examine those horses as soon as possible. Your veterinarian is going to be your best resource when it comes to how to quarantine, how to disinfect, how to treat, how to diagnose, all of those things. Otherwise, you're going to be dealing with this for months and months and months and months and months, and it's going to be a giant pain in your butt.
Yes.
So get your veterinarian involved early and to give you the best possible outcome.
Okay. So what I'm taking away from this then is, and me speaking to the horse community, here's ways that we can help prevent it and what we should do. So first of all, don't share any tack or water buckets or anything like that with other horses at events, or horses that they're not pastured with or live on the same property with. And if you have a new horse come to your property, make sure that it's in quarantine for 30 days. And if during that time you see the horse have swollen lymph nodes, runny nose,
Fever.
what about like eyes, watery eyes, anything like that? Anything, contact a vet immediately to see if this horse does have something more serious. And if you do purchase used tack, make sure to clean it very well before using it on your own horse. And if you do have a situation where you have infected horses, make sure to clean all of your gear before, don't take your boots and go and wander off into town. It's a good idea to clean your stuff before you go elsewhere. And we want to make sure that we vaccinate our horses against the bacteria.
Absolutely. The vaccine is to be, if your horse has never received the vaccine before, it needs to be boosted 2 to 4 weeks after it receives its initial vaccine, and then it can be administered annually. So initially 2 vaccines, then annually thereafter.
Okay. I think that's a pretty good list for things to be aware of.
Absolutely. When in doubt, ask your vet.
Well, thank you, Dr. Leah, so much for coming and explaining Strangles to us. I hope this really helps a lot of you out there who maybe don't know what Strangles is or what it can do. So thank you so much for taking the time to share this information with everybody.
Well, thank you for having me, and I hope that it helps the horse community to understand what Strangles is and how to safely protect themselves and their horses.
Well, folks, that's it for today. If you'd like to learn more, you can start out by hitting that subscribe button. Thanks so much for watching. Have a great day.